You are with the news here. You are with Nation Now. I'm Seher Zama. Thanks for being with us. Let's keep you abreast with the latest numbers that have come in. This, of course, just a short while back announced by the Health Ministry as well. We're looking at the highest rise in positive cases that have been reported just in the past 24 hours. 693 cases reported in past 24 hours. With that, the total number has gone up to 4,067. The number of deaths has gone up as well. We're looking at a total death toll now across India standing at 109. While that grim news continues to trickle in, government measures continue to be taken as far as putting in stringent measures in observing across the country measures of the lockdown, but more importantly also gathering in those funds for preparedness. This was a crucial decision that was taken in by the cabinet today, was held earlier with the president, prime minister, state governors, ministers, and this is what has been decided. An announcement of that was made in from the union minister Prakash Jawdekar, saying that the MPs, state governors, prime minister, president and the MPs have decided to take a pay cut of 30%. This 30% salary cut is going to be for 1 full year. The money will go to the country's consolidated fund. Meanwhile, a hospital in Mumbai has been cordoned off as well. And this is because 3 doctors, 26 nurses, medical staff there were tested positive for the virus. These are the quick updates coming in so far. But let's also get you various cases, examples of a lockdown, a violation of the lockdown that has shamefully reported by many people, and many of these have included BJP leaders, workers and MLAs as well. In the first instance, in the first case regarding this that has been reported, that is coming from the worst hit state of Maharashtra. A BJP MLA decided to celebrate his birthday on a charitable note in distributing ration and food packets, but here's how this has gone horribly wrong. This is an incident that is coming in from Varda. People who heard about this gathered in outside at his doorstep, at his residence, to receive those food packets and rations. There were about hundreds who gathered in, completely violating all norms of social distancing. That is the nature of the crowd there at his doorstep. Now, with this, an FIR that has been registered against him as well. The MLA, of course, has denied any wrongdoing, saying that this is a politically motivated charge against him. Our deputy news editor Mayuresh is getting us further details here on this. Mayuresh, even though the MLA here, Dadarao Keche, says that this has been a politically motivated charge against him, but at the end of the day, this is the very reason why people had gathered, thinking that they will be getting the ration, they will be getting food packets here, and in no time you had about hundreds at his doorstep. Okay, we're going to be getting in those inputs in just a bit, but let's also listen in to what has been spoken here on this. The concerned MLA himself has spoken out here on this. Let's take a listen in.
हे विरोधकांचं षडयंत्र आहे की आवाहन केल्यानंतर हे आवाहन कसं परतवून लावायचं आणि आमदारांचं एक एकंदरीत षडयंत्र हे खेचून न्यावं या भावनेतूनच हे षडयंत्र घडवण्याचं काम विरोधकांनी केलं.
Okay, this is what Dadarao Keche has said, the BJP MLA there, in wanting to mark his birthday on a charitable note there, but in the number of people that gathered in right outside his doorstep. Remember, this is a time where some have faced difficulties as far as access to essentials here is concerned, as far as affordability of food and essentials here is concerned. After getting in news that the concerned MLA would be distributing ration and food packets at his doorstep on his birthday, This is how people had gathered in. These are the images that are coming in. Remember, this is right outside his residence, right at his doorstep. A huge crowd, an absolute majba and a gathering of people that we see here, where all social distancing norms have been violated. Remember, it is important to note that several times it has been mentioned by various governments here that if lockdown violations are being reported, if social distancing norms are being violated, there will be action taken against. This is going to be dealt with by the police, and this is what we're looking at in this case here as well. An FIR that has been registered against him. Is not just the standalone case that has been reported. Remember, in several of these lockdown violation cases that have come in, some of them have come in as far as the BJP leadership here is concerned. Remember, this is another case coming in of a BJP MLA in Hyderabad. In all the enthusiasm that we've seen as far as marking Sunday evening, last evening, the Diya Jalao that was being requested by the Prime Minister, several have violated lockdown norms in that as well. If you listen into these images coming in, this is from the BJP MLA in Hyderabad. He stepped down on the street, holding these flames, this mashal, standing with his supporters, shoulder to shoulder.
Go back, go back. Chinese virus, go back. 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 Go back, go back.
We have with us our correspondent Paul getting us those inputs here. Paul, as is being established very clearly in these visuals here, that this is yet another BJP leader, the BJP MLA in Hyderabad has violated the lockdown norms here in stepping down out on the street with a whole gang of his supporters here, standing close by, shoulder to shoulder. Any action taken against him yet?
Well, sir, it seems like the rules are different for the common man and for leaders who have been elected to power. No action, firstly, let me answer your question, no action taken by the BJP unit. And this is not the first time. He is known to be a controversial BJP MLA. He is BJP's lone MLA from the state of Telangana. And this time, despite PM very clearly saying that please light a diya or candle in your balconies, do not step out of your homes, also ensure that you're not in a group. This BJP MLA wanted to show his loyalty towards the Prime Minister probably. He stepped out, you can see on the roads. He's the BJP MLA from Goshamal constituency, and his supporters, all of them, instead of holding diyas or candles, they can be seen holding fire torches in their hand, and they were there sloganeering, go back, China virus, go back. No social distancing, calling it China virus. And that's not the only thing that he's done. In fact, after 6 p.m. in Telangana, there is a lockdown. There is a serious curfew. The common man is not allowed to step out. During the day, you can step out for essentials. But after 6 p.m., it's a complete lockdown. We wonder how the BJP MLA got about with his supporters standing like that in the open, on the main road, and sloganeering. No action taken as yet. A lot of people, sir, on social media have demanded that if the common man can be held responsible and accountable, even this particular leader should be held accountable.
Right. And Paul, as you pointed out there, not just violating norms of the lockdown, but also making a questionable remark in calling this China virus. Remember, we have seen in other parts of the world here, in associating this with China, which has invited a lot of hate as well. So that is questionable as well, to be calling this a China virus and associating this with one particular country and creating that hate against China.
That's right. We have seen several controversies in the past wherein several world leaders, including Trump himself, had called it China virus. And then there was a section of the society felt it's wrong to call it China virus. Here we are seeing this BJP MLA call it China virus. We're just hoping that this kind of sloganeering would drive away the deadly virus. But it definitely doesn't. So we wonder what is the purpose of actually gathering a crowd, going against social distancing. You can see them wearing the masks on their necks. They've removed their masks, they're sloganeering, holding fire torches and together going about the street. They're not moving, at least in these visuals. You can see them gather in Goshamal constituency. So violating the lockdown, holding fire torches and also breaking all kind of rules that have been set down for the common public. So why shouldn't the leader be held responsible? Why shouldn't the BJP Telangana unit take action? That is the big question a lot of people are asking, sir.
Yes, still no action taken. Remember that this is Sunday night, Sunday evening's incident that has come in and no action so far. Paul, thank you for getting us those inputs. In other news, regarding another BJP worker who's also the nephew of a senior party leader has resorted to a bizarre act. Some have called it casteist as well. He chose to sprinkle Ganga Jal, which is outside a facility where the Tablighi Jamaat attendees have been put on quarantine. This is in the Kolkata area. Remember, this is an area outside which there has already been sanitized, but over and above that, purification act of sprinkling Ganga Jal, which is now being questioned. This is the Delhi BJP State General Secretary Vikram Biduri, who is also the nephew of senior BJP leader Ramesh Biduri. Let's get in further inputs. Our correspondent Alok has been getting us these details here. Remember, this is with respect to reportage concerning the attendees of the Tablighi Jamaat, which has seen a rise in the positive cases across the country here. Alok, given that the area outside with authorities fully aware of what they're dealing with, when you have a group that has been put on quarantine in the area here, the surrounding area which has already been disinfected and sanitized, what does this purification act of Ganga Jal mean then?
Well, absolutely, yes. And in fact, this is a sort of controversy that is now broke out because the way this whole activity was done and the Twitter and the tweet was put out in which it was said that these persons who are staying there, they are anti-national, because in the tweet there they have used the person who has tweeted has said that these persons who are staying there, they are anti-national as well. And apart from that, he has said that he wanted to purify that particular area. So definitely these two terms are not at all very much, in fact, significant for this particular whole exercise. If you want to sanitize the area, you need not to tweet it by blaming people who are already victims. What we are saying that these people who are in the quarantine, they all are victims of this whole disease, and pointing them out as a culprit or pointing them out as an anti-national, that is a wrong way that the BJP leader has done. Definitely this is condemnable, but as of now he has already tweeted it and the controversy has broken out. So definitely that other people are also in fact criticizing the tweet.
Right. Alok, also the question here on how he was allowed to do this, gather in outside the area, which is housing quarantine attendees here at a time of the lockdown to be doing this. How did he manage to go about doing this is the question as well.
Well, as far as the quarantine exercise, but that is being allowed by the administration. If you want to voluntarily do any kind of this kind of activity, you are allowed to do, but you have to maintain social distancing. So, because what the BJP leaders are saying that whatever these kinds of exercise they are doing, they are maintaining social distancing. So this is why this is why the administration has not questioned them out during that activity. But remember, this 167 persons are staying there. They are all from Tablighi Jamaat. Remember, we had also, in fact, reported about these people who are staying there. They were, in fact, not at all cooperating at that point in time with the medical staff and the police staff. But later after that, they were all pacified. So definitely that area is little bit questionable now with this whole activity, which the BJP leader did. And after that, put out a tweet. That tweet is little bit objectionable. Back to you.
Yes. Alok, thank you for getting us those inputs here. And this is yet another incident now that is coming from Jammu, where senior government officials who should be respecting all sorts of norms there put across for the regular people and for the government officers to follow as much equally as well. But there has been a violation here as well. Senior government officials who had gathered at a government medical hospital, and this was to sanitize. This was in fact to install a sanitized tunnel. But in those images, as you see, all sorts of social distancing norms not followed. Times Network correspondent Pradeep Datta getting us these details.
On one hand, they are claiming that they are providing sanitizer so that there's no contamination, so that people do not carry any kind of germ. On the other hand, you can see the kind of the violation that is going on. This is simply a violation. They're violating those social distance norm, because reason being that all of them had been waiting for the Commissioner Secretary Health to arrive, and during the process you can see large number of people have already gathered there. There is no social distancing as per social distancing norm. People have to stay just few meters away from each other. But here you can see everybody is jostling for that space, because they're more for the publicity rather than for caring for the disease. Already there had been spike in cases, and in most of the cases it has been seen that the people who have not maintained the social distance, they had been responsible for that. But when authorities fail to understand this thing, so how come you are going to generate awareness among common masses, especially from the rural areas and the illiterate people who hardly have any idea about this thing? Totally that social distancing is being in fact violated by the officials here, because they wanted to inaugurate. This is not the time when you have to go for the publicity, or you have to go for any kind of optics, or you have to go for any kind of a publicity stunt because you want to inaugurate. Already here in Jammu region, people are late in installing these sanitizers, while as in Kashmir Valley it has been installed long back. But despite that thing, they are trying to make it a big event. They are more for optics, they are more for the photo obsession, and you can see in the process, this is what exactly how they are maintaining a kind of a social distancing here at the Government Medical College here in Jammu. This is complete violation. Who will be really answerable to this thing? If tomorrow there is not, one can't deny this fact that there is every possibility somebody from here must be carrying infection back home. Then who will be responsible for that? Authorities who kept people waiting for inauguration of this sanitizer here at the Government Medical College, or somebody else?
Now, this is a shocking act that is coming in from Balrampur BJP Women's Cell President Manju Tiwari. Last evening, when people of the country were busy lighting diyas in solidarity as a solemn occasion, she was saying indulging in celebratory firing as well. Not just that, she also had a video shot of herself while she was shooting in the air. Remember, this is something that is banned by law. Manju Tiwari is the BJP Women's Cell President who's been identified now. She has been suspended by the party for indiscipline. She has also been booked for firing in the air. She's been on the back foot. She's apologized, but she's also given an explanation here on this, saying that she felt it was Diwali. She felt it was a celebratory occasion, and so she fired in the air. Let's get in further details. Correspondent Amir Haq getting us those inputs here. Amir, this is of course disciplinary action that has been taken by the party against her, but this is coming on also a very, very insensitive note. In a solemn occasion here, to feel that it is Diwali and then celebratory fire in the air.
Well, absolutely, very insensitive of this woman leader from the BJP from Balrampur to have acted in this manner, and huge embarrassment for the party state unit out here, because although they have suspended Manju Tiwari, but the police has gone ahead. It has registered a case against Manju Tiwari, and although she's repeatedly apologized, she's also put out a video wherein she's accepting her mistake and in fact vowing that she will not do or repeat this act again. But the fact is that it was hugely irresponsible for her to have indulged in this act. And the revolver that she is using to fire in the air, it belongs to her husband, and her husband was there, along with her, giving her directions how to fire it in the air. And if you look at the visual closely, she cannot hold her fire. The manner in which she's pressing the trigger, the firearm moves completely 90 degrees towards her front, and that could have actually proved fatal to
That's
anybody
right.
who was around in the vicinity. So this is a hugely irresponsible act for her, and police actually doing right to go ahead and book her for the kind of act that she's done.
Amir, please stay on with us. This is not just the only irresponsible, absurd act that has been reported here, and continuing with updates coming in from UP. This is information now that's coming in as far as Bareilly is concerned. And in yet another shameful incident as far as our frontline warriors being attacked in the line of duty. Remember, they're out on the street here working for our own good, our own safety here, to keep homes, to keep at home in maintaining social distancing. But when the UP police instructed about 20 people who were flouting these prohibitory orders and asking them to disperse, the police was attacked. The police here says that the crowd attacked the police, in which several policemen have sustained injuries. The police claims a retaliatory move that they faced, and then they were because with respect to the enforced lockdown, the police have arrested about 15 to 17 people in this incident, still identifying others here. Amir, this is yet another shameful incident here. We don't want our police, we don't want our doctors to be attacked in this manner.
Well, yes, you're absolutely right. And another shameful incident coming in from UP. We've had similar incidents earlier happening in Kannauj as well as in Muzaffarnagar, wherein people got to attack the police. And in this particular case, in fact, the police team was there in the Izzat Nagar police station area of Bareilly, looking for people belonging to the Jamaat in that particular locality. When people started coming out in large numbers, they congregated in the form of a mob, and in fact tried to harm the police over there, to attack the police, and also to attack the police outpost in that particular area. It was then that the police had to call in for reinforcements, and then force was used to quell the crowd, to disperse the crowd, around which about 17 to 18 people were also arrested by the police. But yes, police personnel were also attacked, and they've also suffered injuries, including an IPS officer who thankfully escaped with minor injuries. But yes, a hugely embarrassing situation there, and very, very shameful incident at that.
Amir, thank you for getting us those inputs there. And while we are at this report, let's also play out the reaction that's coming from the Bareilly SP. Let's take a listen in.
इज्जत नगर थाना अंतर्गत में करवापुर एक गाँव है, जहाँ पे लॉकडाउन को इन्फोर्स कराने के लिए पुलिस पार्टी गई थी। हमारी चीता मोबाइल गई थी। चीता मोबाइल पे 2 लोग थे और एक जगह पे 15-20 लोग इकट्ठे थे। उनको चीता मोबाइल ने बोला कि भाई आप लोग यहाँ पे क्यों हैं, आप लोग घर चले जाइए। तो उसमें से कुछ लोगों ने पुलिस को जो है पुलिस का मजाक उड़ाना शुरू कर दिया। उस पर एक लोग को हम उठा कर वहाँ से लाने की कोशिश की। गाँव वालों ने छुड़ा लिया। फिर क्राउड इकट्ठा होकर हमारे ये जो चौकी है इज्जत नगर का बैरियर 1 वहाँ पे आ गए। तो फोर्स हम यहाँ पे लाए और फोर्स लाकर जो है उनको हम यहाँ से हटा दिया। फिर उनको गांव तक खदेड़ कर ले गया। लोगों ने चौकी पे घेराव कर दिया था और पुलिस पार्टी पे हमला करने की नीयत से आए थे। पुलिस पार्टी पे हमला कर रहे थे। गांव में जाकर हमने तंबी की, कुछ लोगों को उठा के लाए, आइडेंटिफाई किया। जो लोग यहाँ पे चौकी पे आए थे उनको आइडेंटिफाई किया। 15-17 लोग को हमने हिरासत में ले लिया है। उनको हम थाने पे ले गए। उन पर हम FIR करके सख्त से सख्त उसमें IPC की धारा लगाकर हमको जेल भेजा।
On that note, we're slipping into a very tiny breather here on Nation Now. Stay on with us, please. Back in just a bit. Thanks for staying on. Earlier today, a cabinet meeting that had taken place and a crucial announcement that was then made by Union Minister Prakash Jawdekar in saying that this is what has been decided, that salaries of all MPs, which includes Prime Minister as well, which includes other state cabinet ministers, will be reduced by 30%, and this is for a period of 1 year. Not just that, this is also going to add in as far as the president goes, the president of India, the vice president, and all governors have decided to do the same, to slash their salaries by 30% for a period of 1 year. The savings of this large chunk then will be consolidated and go into the fund of India, and the entire amount that will be used there to fight COVID-19 across the country. Mr. Jawaharkar, they're saying that the cabinet has approved a temporary suspension of MP-led funds as well, the use of MP-led funds, which is dedicated to each of the MPs for their constituencies here. And those funds is going to be made available. This is for a period of 2 years. The consolidated amount of MP-led funds has been calculated, will be roughly about 7,900 crore rupees there, going into this consolidated fund of India. These are the details.
In the cabinet meeting, 2 important and milestone decisions have been taken. Because all MPs were feeling, all ministers were feeling, Prime Minister himself, everybody wanted to start charity begins at home. So it should start from self. And therefore, we have decided for an ordinance, because it's a legal requirement, because it's a law under which we get our salary, and therefore that law needs to be amended. So there will be 30% cut in the salaries of Prime Minister, of ministers, of members of Parliament for the whole year of 2021. So for 12 months, this will take place. And second, in a second decision, the MP lad, because many Parliament members had given their MP lads for this work. So instead of piecemeal, a comprehensive decision has been taken to suspend the MP lad, that is Local Area Development Fund of members of Parliament, will remain suspended for next 2 years, that is 2021 and 22.
These are breaking inputs coming in of at least 92 staff members. This includes several doctors of the D.Y. Patil Hospital in Pune who have been quarantined after an accident. Victim who was being treated at the hospital at the facility has tested positive for coronavirus. The patient developed a fever during his treatment. His samples were then taken for testing, which have come back positive. So the patient was then immediately shifted to the hospital dealing with coronavirus patients. This was at the Yashwantrao Chavan Memorial Hospital. But because of this, of all the medical practitioners in that hospital who've been in touch with him, who've been exposed to the positive coronavirus patients, 42 doctors, 50 paramedical staff members now have been quarantined as a precaution. Remember, this is a total of 92. This is a large number that we're looking at, given that each hand counts now at the hospital. And in the details that were earlier announced of the latest figures here by the Union Health Ministry, let's revisit those figures that have been reported now officially. We're looking at a total number of cases of 4,067. And it has been the biggest jump of the past 24 hours of positive cases that we've seen, which is 693. The total number of fatalities has also further spiked up with 30 new reported cases of deaths. This is since the past 24 hours, and the total number of fatalities now stands across the country at 109. Other details that were given out as well with respect to how many here are have tested positive from the Markaz event here. This has been attributed to 1,445 out of the total of what we're looking at across the country. Another explanation there came in that a larger percentage of the fatalities, of the number of deaths that have been reported from across the country, has also been because of comorbidity, which is a combination of another ailment, and in most cases it has been a combination of heart ailment. Take a listen in those details here.
अगर हम देखें कि पिछले दिन से आज तक में तो अराउंड 693 नए पॉजिटिव केसेस आए हैं और आज टोटल केसेस की संख्या 4067 है, जिसमें से 1445 केसेस, एज आई मेंशन्ड यस्टरडे, दे आर रिलेटेड टू तबलीगी जमात कंफर्म केसेस। अब तक आए अगर हम टोटल केसेस को एनालिसिस करें तो जेंडर के डिस्ट्रीब्यूशन पर देखते हैं तो अराउंड 76% केसेस मेल्स में एंड 24% केसेस फीमेल्स में पाए गए हैं। साथ ही अगर हम एज के बेसिस पर डिस्ट्रीब्यूशन को एनालाइज करें तो 47% केसेस, लेट मी जस्ट हाईलाइट, 47% केसेस आर इन पीपल with less than 40 years of age. 34% cases are between people from 40 to 60 years of age, and 19% cases are for people 60 years and above. State country में अब तक total 109 deaths report हुई हैं, जिसमें से 30 deaths have been reported only yesterday. और इन deaths को भी अगर हम analyze करें तो हम पाते हैं कि 73% deaths are related with males and 27% are found in females. Mortality का अगर एज डिस्ट्रीब्यूशन भी आप देखें तो उसमें 63% deaths they have been reported with people 60 years and above, that is elderly people. 30% deaths have been reported between people from 40 to 60 years, and 7% deaths have been reported from people below 40 years.
Okay, that is analysis now that has just been released by the Union Health Ministry as far as taking into account those who've reported positive, but also analyzing data that is available on fatalities that have been reported across the country. Remember, we're looking at a number of 109 reported deaths because of coronavirus across India. That data is being analyzed as well with respect to the age of the patient, with respect to comorbidity, whether or not this happened because of another ailment. In 86% it was reported here that it happened because of a combination of heart ailment as well. It is further being split as far as the percentage of women reported and men reported in this case. Remember, this is going to be a continuous process of analyzing data available and figures that are coming in of positive cases and those, unfortunately, who have succumbed as well. Apart from these figures and analysis of the fatalities here, there were other announcements that came in from the Health Ministry as well. One that came in on a good note, this is with respect to availability of rapid testing kits. Remember, rapid testing kits which are to arrive in India in 2 days' time, which is then as a priority going to be sent across to the hotspot areas, those areas across the country which have reported the maximum, a larger number of positive cases. That is where in areas where a large number of people have been put on quarantine, suspected exposure to positive patients, rapid testing kits are going to be used there as a priority till the next lot arrives. So far, we've been told that 5 lakh kits of rapid testing are to arrive in 2 days' time. Wednesday onwards, this is going to be used in all the hotspot areas that have been identified across the country. We're going to be getting in further inputs here from our correspondent Ayushman on that in just a bit. But let's once again revisit the analysis of that data that has come in here from the Joint Secretary Health Ministry, Mr. Love Agarwal.
अगर हम देखें कि पिछले दिन से आज तक में तो अराउंड 693 नए पॉजिटिव केसेस आए हैं और आज टोटल केसेस की संख्या 4067 है, जिसमें से 1445 केसेस, as I mentioned yesterday, they are related to तबलीगी जमात confirmed cases. अब तक आए अगर हम टोटल केसेस को एनालिसिस करें तो जेंडर के डिस्ट्रीब्यूशन पर देखते हैं तो अराउंड 76% केसेस मेल्स में एंड 24% केसेस फीमेल्स में पाए गए हैं। साथ ही अगर हम एज के बेसिस पर डिस्ट्रीब्यूशन को एनालाइज करें तो 47% केसेस, लेट मी जस्ट हाईलाइट, 47% केसेस आर इन पीपल with less than 40 years of age. 34% cases are between people from 40 to 60 years of age, and 19% cases are for people 60 years and above. State country में अब तक total 109 deaths report हुई हैं, जिसमें से 30 deaths have been reported only yesterday. और इन deaths को भी अगर हम analyze करें तो हम पाते हैं कि 73% deaths are related with males and 27% are found in females. मॉर्टेलिटी का अगर एज डिस्ट्रीब्यूशन भी आप देखें तो उसमें 63% डेथ्स they have been reported with people 60 years and above, that is elderly people. 30% deaths have been reported between people from 40 to 60 years, and 7% deaths have been reported from people below 40 years.
Let's get in further details. Our correspondent Ayushman getting us those inputs here. Ayushman, we'll be seeing how the figure of fatalities is now being analyzed. This was, of course, going to help us now and henceforth as far as treatment of other positive patients is concerned as well. But on preparedness, the rapid testing kits which are to arrive in 2 days' time is to be available first in the hotspots here. How are these rapid testing kits going to help on ground? Would it mean that this is a safety test first and then you still have to go through the conventional testing method here? How is rapid testing going to help in the hotspots?
Well, sir, first of all, the ICMR has now said, because we spoke to ICMR on the testing kits, rapid testing kits availability, and on that, the ICMR said that the 5 lakh kits which are coming to the ICMR by Wednesday, they would be used by the states as well, and in the hotspots that also will be used. But at the same time, we have also got reports in like Tathagat Dev of T.S. Singh Dev of Chhattisgarh has tweeted earlier. There are several states who already have these antibody rapid testing kits with them, so they can also now continue the serological test by using the blood test. Now, from here, this would be an indicator. If somebody is having an influenza-like illness, that test can be conducted and it can be used to ascertain if that person is suffering from COVID-19 or not. If the test comes negative, then PCR test will again take place, which is the common test which is being conducted for COVID-19. If that also comes negative, again after 10 days, antibody test will be done so as to ascertain if that person is not suffering from COVID-19. So in all these localities, in 274 districts, in several clusters from where we have seen cases coming up, this is the method which has been adopted in order to identify if new cases have emerged or not. So far, Seher, we have seen the cases crossing 4,000 mark right now. But definitely the health ministry is saying that this serological test which ICMR is doing right now will be used to ascertain if the community spread, if at all, has happened. We can see and identify people who are having those influenza-like symptoms, and they can be tested to ascertain if they are suffering from COVID-19 or not.
Well, Ayushman, please stay on with us. That's an important update here on how rapid testing kits urgently required are now going to finally be here and eventually help in the larger process of identification. These are breaking inputs now coming in as far as the government meet on the lockdown here is concerned. The Empowered Committee, which is meeting here at North Block, and this is to discuss the exit plan from 14th April. Remember, we're barely about 7 to 8 days away. We've lived through halfway down 21 days of the lockdown. But what is going to be the decision on 14th April? A smooth exit plan. Home Secretary chairing the meet here. It is in the presence of other officials attending this meet from Niti Aayog, from Ministry of Civil Aviation. Remember, flights have been completely grounded. Ministry of Pharmaceutical, Ministry of Agriculture, Ministry of Industry, Trade, Railway Board reps from FICCI and CII, all industry reps in this meet as well. So this is going to be a very, very holistic approach as far as the exit plan for 14th April goes. A lot that is going to be taken into account in this meet. Our correspondent Ayushman is getting us those inputs here. Ayushman, this is going to concern the civil aviation industry. What to do next? Will flights be booked after 14th? Ministry of Agriculture as well, as far as farmers' distress is concerned. Also, industry reps of FICCI and CII in this meet as well.
Yes, sir. In fact, right now, if you see at this meeting, very important meeting taking place right now, where the Empowered Committee is meeting at the North Block to discuss the exit plan as to how, what will happen, because there has been a lot of rumors doing also around, and there is a lot many speculations as to what will happen post 14th. Currently, Home Secretary is chairing the meet. Officials from Niti Aayog, Civil Aviation, Ministry of Pharmaceutical, Ministry of Agriculture, Industry, Trade, Railway Board, and also representatives from TI and FICCI are present over this discussion. But currently, there has been clearly it has been said that the kind of lockdown that we are witnessing, it has been appealed from the health ministry, it has been discussed with the chief secretary as well, that this lockdown till the point it lasts, the 21-day lockdown should be followed by people, because it is very important to break the transmission chain which has resulted in the rise of number of cases that we are discussing in India.
Yes. True that. Ayushman, thank you for getting us those details. The inputs of this meet would be known in a short while from now. We'll get those details from you later. In Mumbai, an important decision now that has been taken by the BMC. This after the 5th positive case was reported from Asia's largest slum in Mumbai, there, Dharavi. Now the BMC's preparedness plan here is to get more beds ready in hospitals nearby Dharavi, which are dealing specifically with COVID-19 patients here. To have an increase in bed facility, 300 bed facility there at a sports complex nearby, and a 51 bed facility at a hospital in Dharavi. While speaking to Mirror now, the BMC here says that setting up more bed facilities is going to be helpful to tackle the eventuality of an increase in numbers that come in from Dharavi. Remember, after a total of 5 positive cases reported from the slum cluster so far, 3,500 people now have been put on home quarantine. Our correspondent Disha is getting us further inputs here. This is where 2 confirmed patients were found. This is within the Dharavi area, the area that has now been declared as part of a containment zone. Disha is on ground getting us those inputs here. Remember, the process of containment is that the area is entirely sealed. No one will be allowed to step out even to buy basic essentials and groceries. It's a process that continues for a few hours. Our correspondent Disha, who's been there and getting us those details here. Disha, please get us further. Yes, if my voice is going through, please go ahead there, Disha, on what's happening right now, how much of the process here in the containment zone is done.
Well, if you talk particularly about Dharavi, 3,500 people have been quarantined till now is what we understand. In Dharavi, because Dharavi, as we know, is a highly densely populated area. It has been declared as one of the hotspot, one of the containment areas where at least few pockets are very sensitive, like Dr. Baliga Nagar, Madina Nagar, Mukund Nagar, where all of these positive cases have been found in the last couple of days. Keeping this in mind as a precautionary measure, the BMC has now actually, taken over one Sai hospital in Dharavi with a capacity of 51 beds and 8 ICUs. So in case if more positive patients are found, directly they will be taken there for further treatment. Secondly, what we know, they have also started a facility like institutionally quarantining, which essentially means that high-risk patients who have directly come in contact with the positive patients are found with symptoms. They are directly being sent to this institutional quarantine facility, which has been set up at Rajiv Gandhi Sports Complex in Dharavi, where there is a 300-bed capacity. And 25 people have already been quarantined there. So as of now, on the ground level, what we talk particularly about Dharavi, 5 positive cases have been found so far, including 1 death. We are talking about 3,500 people being quarantined out of 8 lakh population. And BMC, lastly, as a precautionary measure, they have also set up health camps where people are being screened on a daily basis. Symptomatic patients are being tested and sent for further treatment.
All right, so this is very, very procedural and important here as far as containment of coronavirus in the given area is concerned. Disha, thank you for getting us those details. And staying with inputs here that are coming in from Mumbai, after videos that surfaced on social media, there was shown a huge concern here of poor sanitation in some of the most important hospitals here in Mumbai. Mumbai's Podar Hospital, after that went viral. Patients in the quarantine now being forced to clean their rooms. This is coming in on a shocking note. Maharashtra Minister Aditya Thackeray has responded here saying that he is now in touch with the hospital authority, now in touch with the patients here, and that action that has been taken against those responsible in having patients clean up the space as well. He's also said that the patients have now been shifted to another hospital till the cleanup process here is on. Our Deputy News Editor Mayuresh getting us further inputs here on this. Mayuresh, this is shocking. If this hadn't been brought to the notice of the minister, patients would have been harassed in this manner. And remember, these are patients at the end of the day.
Yes, these are the patients, and they have been asked to get into the quarantine facility, and they were shifted to the Podar hospital in same vicinity. But when they reached there, they found that the place was not clean. There were a lot of garbage was there. Even if you see in the video which went viral on the Facebook, even the toilets were not clean. So they even asked the ward boys as well as the sweeper of that particular hospital, but they refused to help them and refused to clean the place. Hence, they took out the video and put it on the Facebook and other social networking websites. Coincidentally, Aditya Thackeray, who is a minister, he is from that particular constituency, Worli constituency. The message reached to him, and within no time, we can say that Aditya Thackeray decided to shift these people. There are more than 100 people to other facility where the place is clean, neat, and atmosphere is good for the quarantine people. So if you see that these people again have posted a video thanking Aditya Thackeray for such kind of move.
All right, corrective measure well in time now that has been taken by the State Minister Aditya Thackeray on this case. Mayuresh, thank you for getting us those details. The latest now that's coming in specifically from a hospital in Kolkata, where 40 doctors and medical staff of a government hospital in Kolkata now have been put on quarantine. This is because after a patient who passed away and was later to be found out, the patient who passed away last week, but after his death it was ascertained that he was coronavirus positive. After this, all the doctors who had exposure to him at a time when he was in the hospital now have been put on quarantine. 40 doctors and medical staff members of that government hospital. We have with us our correspondent Tamal getting us those details here. Tamal, while 40 of these doctors and medical staff of the hospital is being taken care of at quarantine, but is the hospital operational anymore?
Well, yes, the hospital is still operational, but then that 40 has now gone up to 58. So here 58 medical staff, including doctors and other medical staff, have now been quarantined because they had come in contact with one patient who had turned out to be a COVID positive patient who was admitted on last Wednesday. He did not complain about specifically about symptoms which are quite similar to COVID. He came to the hospital, to the government hospital with some other ailments, and he unfortunately passed away on Saturday. Before he passed away, his samples were collected and were sent for testing. By the time the test reports came, he was no more. But the test results had come to be positive. From Wednesday till Saturday, his health condition had deteriorated and he had even to ICCU. But before that, he was also there at the general ward, which means several other doctors, medical staff had gotten the exposure to him or accidentally came in contact with this patient. So yes, all the medical staff and the doctors have now been quarantined, 58 of them. But then it's a big question what happens to other patients who were unfortunately in that same ward. What measures are the government really planning to take for those patients, because they are patients, they're admitted. You cannot really take a patient out of a hospital and quarantine because the patient requires medical assistance and supervision. So yes, the is trying to ensure that no one gets affected because of one COVID person who was there as a patient at a general ward and later got identified as a COVID patient. So we have to wait and see how long this hospital operates and what are the other measures being adopted by the government to ensure the virus doesn't spread to others.
All right. So the hospital is operating, but understandably, of course, it is on skeletal staff while the rest of the team there is on quarantine. Tamal, many thanks for getting us those inputs. On that note, it's a wrap here on the show. It's a wrap on Nation Now. Thanks for being with us. But we'll leave you behind with a quick reminder here, an important reminder as far as how you can contribute to those who are most need in funds at the time of this lockdown. Remember, there are several who are dependent on a daily wage, who are out of job, out of work, have no food, have no shelter either, have been driven away. And here's how you can contribute positively here, adding to those funds in charity. You can send in your contributions to PM Cares Fund. You can do this either by net banking, or you can use any of your UPI based payments as well, your payment apps. It's fairly simple, but if you still need more information how to go about this, there is www.pmindia.gov.in. Thank you.